Conscious Deep Breathing and Intern Stress, a research project by Kelsey Paul. Introduction. The issue addressed in this study was stress levels, specifically stress levels in working individuals. Stress is one of the most common health problems people are facing in the world today. This issue was addressed through deep breathing techniques. There are many different types of deep breathing exercise, including yoga, Pilates, meditation, and more. Research has shown that deep breathing can have a positive effect on individuals' stress levels. It is also said that deep breathing can help reduce the risk of developing stress-related illnesses. The problem of high stress is significant because of the many physical health conditions it can cause. Stress is said to contribute to about 50% of depression causes. It can also be related to other physical conditions such as cardiovascular disease, hypertension, obesity, metabolic syndrome, infertility, and more. The purpose of this study is to determine whether deep breathing techniques can actually reduce stress levels. This study is very applicable to the field of social work. Considering social work often places individuals in high-stress situations, finding ways to reduce stress could be very beneficial. A recent study found that many people leave their jobs due to too much stress. It is important to find ways to reduce stress, especially for social workers, if we don't want them to leave the profession. Literature review. Many different studies were reviewed that focus on reducing stress through deep breathing. In the first study, a method of breathing called Nishino breathing, which involves deep concentrated breathing, visualization, and some slow body movements, was studied. Participants attended a Nishino breathing class which lasted about 1.5 hours to 2 hours. The results of this study found that the mean stress levels of participants significantly decreased after taking part in the Nishino breathing method. In the second study, researchers wanted to focus on decreasing stress levels as well as the effect of deep breathing on cardiovascular and respiratory functions. Researchers asked participants to sit quietly in a peaceful environment for about 20 minutes twice a day for 8 days. Half of the participants were instructed in the practice of pranayama, which is breath control. The other half of the participants were not instructed in any breathing methods. Results found that pulse rate was lowered in all participants regardless of deep breathing practices or not. The third study focused on the effects of pranayamic breathing after only 3 to 5 minutes. Researchers wanted to see if there was any immediate benefits from deep breathing. Results showed that after 5 minutes of slow-paced breathing, systolic and diastolic blood pressure decreased. A fourth study focused on tension and anxiety in Japanese women who were going through chemotherapy. Results found that after 10 minutes of deep breathing, tension and anxiety levels decreased in the women who participated in the deep breathing compared to those who did not. In this last study, a music and breathing combination intervention was done on emergency room patients. Researchers surveyed over 140 individuals. Overall, the study found that through both music and breathing interventions, stress levels were reduced in participants based off of self-report. Overall, through the literature review, we see that deep breathing interventions have been successful in reducing stress in individuals. Study purpose. The research question for this study is, can deep breathing exercises for only 3 minutes a day reduce feelings of stress in social work interns? As our literature review showed, many deep breathing exercises have been effective in reducing stress. However, few studies have been done on the immediate effects of short interventions that last only a few minutes. For individuals working in fast-paced and high-stress environments, having 20 to 30 minutes to set aside during your day to take part in deep breathing exercises isn't a very realistic option. However, having 3 to 5 minutes during the day to practice deep breathing is realistic. This study was done in order to extend existing knowledge through showing the immediate effects of a short duration of deep breathing. Research methodology. This research study used the basic A-B design. There were 2 baseline measurements that took place over the course of 1 week. There were 5 intervention measurements which took place over the course of 3 weeks. The independent variable was a 3-minute deep breathing exercise found through research. The dependent variable was participants' self-reported stress levels in the Everyday Feelings questionnaire, which we will talk about in the next slide. The sample consisted of 2 participants who were both social work interns working on either their bachelor's or master's degree. Both participants were females between the ages of 21 to 41 and working at the same internship. Data was collected each day that the participants were at their assigned social work agency. This typically consisted of twice a week, though sometimes varied due to holidays, vacations, or participants being sick. The data collection procedures for this study first consisted of having participants sign an informed consent form. After this, baseline measurements were taken, followed by intervention measurements. Participants could choose any time of the day to fill out their Everyday Feelings questionnaire after they had completed their 3-minute deep breathing exercise. Participants' stress levels were measured through the Everyday Feelings questionnaire, which has been proved to be a reliable and valid measurement. The Everyday Feelings questionnaire is a quantitative measurement which asks participants 10 questions which they answer on a Likert scale. 5 of the questions focus on participants' negative feelings, while the other 5 focus on their positive feelings. Results. The first step to analyzing data was to assign value to each of the possible answers on the Everyday Feelings questionnaire. Answers were given values between 1 and 5, 1 being for none of the time and 5 being for all of the time. Positive and negative scores were calculated for each test that the participants took. For positive scores, participants could range between 5 points and 25 points. The same is true for negative scores. When participants scored lower on the negative questions, then that represented less negative feelings from the participants. When participants scored higher in the positive questions, that represented more positive feelings from the participant. All this means is that lower negative scores and higher positive scores represent less stress and overall better well-being from participants. Here you can see participant 1's positive and negative scores as well as a chart representation. As you can see, both positive and negative scores fluctuated throughout the intervention process. Participant 1's results show no significant change in stress levels, whether positive or negative. Here we have participant 2's results. Participant 2 did not fluctuate as much as participant 1. However, both positive and negative scores mostly did not change throughout the intervention. Results did show that average negative score for participant 1 decreased by 0.8 points, and average negative score for participant 2 decreased by 1.6 points, meaning their negative feelings at the moment did decrease on average. However, these numbers are too small to make any significant conclusions on whether deep breathing had an effect on their stress levels. Discussion and conclusion. The results of the study were inconclusive and therefore no significant implications for social work research can be made. However, this does not discredit the connection between deep breathing and stress that other researchers have found. Some strengths of the study include using the Everyday Feelings questionnaire as a measurement since it was reliable and valid. Another strength of the study was using a deep breathing intervention that was found through research and was proven to work with others. Some limitations of the study, and perhaps why we had inconclusive results, were things such as not accounting for the other stressful factors in participants' lives other than their internship. Also, no supervision was given to participants while taking part in the intervention. Therefore, it cannot be determined if participants rushed through any of the interventions or took it completely serious. More research is needed on this subject in order to find more conclusive results. Though, as we saw through the literature review, many deep breathing practices have been successful in reducing stress in individuals. There are also many different types of deep breathing exercises. Therefore, if a different deep breathing exercise had been used, it is possible that we would have reached a different outcome. Through completing this research study, I learned about the many different factors that can affect the results of a research study. I also learned about the incredible detail and amount of effort that it takes to complete a research study. Overall, in answering this study's research question of can 3 minutes of deep breathing lessen stress levels in social work interns, the answer is we just don't know.